My dear brothers and sisters, it's not normal for the doctors and healthcare professionals to be alarmist. Our job is to try and get across the information to everyone in a way that does not induce panic and that does not induce any negative reaction. And all the messaging that we've been giving so far as a medical community, as a healthcare community, has been to get across the seriousness of this situation, to get across the importance of taking action, to get across the importance of acting now. But we have reached the limit. In fact, we reached the limit 2 weeks ago. What I'm going to say may sound alarmist, but I am telling you right now, this is not alarmist enough. I'm telling you right now that this is a serious situation and that too many of our community are still not taking heed, Muslim and non-Muslim. I'm telling you right now that we need people to wake up, to be shaken up, and to listen and understand what is happening. There are still far too many people who have weddings that are going ahead with 400, 500 people coming. There are still far too many people who are out on the streets going to the shops, making excuses that they need to buy food as if they're going to starve to death. There are still too many people who are, too many mosques that are still open. There are still too many excuses being made for people to go outside their door when they do not need to do so. So this is a warning that we are giving about what is happening, my brothers and sisters, what is coming to hit us. I'm telling you right now that we are on groups with Muslim healthcare professionals from across the country, from nurses to physios to pharmacists to intensive care to microbiologists, and every single one is like watching and waiting a flood that is going to hit and is going to overwhelm. My brothers and sisters, this is a warning, and we need you all to pass this warning on to your families, to your associates, to your community, Muslim and non-Muslim. This is not a drill. This is not being alarmist to say that the healthcare system is close to collapse. The Prime Minister himself has said that the NHS may be overwhelmed. This is an understatement. Yesterday, the NHS, in the first time in history, has taken over every single private hospital in this country, has commandeered every bed and every single private hospital clinician. Because this is the scale of the situation. Doctors are collapsing, nurses are dying, and they are being put in intensive care in Italy right now. Right now, there are doctors in intensive care simply because they have been treating patients with COVID. And if the doctors and the medics and the nurses and the pharmacists drop out, where will we be left? What will happen to us? This is not a drill. Brothers and sisters, this is not a drill to say that the intensive care units, where people who suffer from this disease, including the young, you have been told again and again, it's people with comorbidities, it's the 80s. This is not accurate. Including the young are also ending up in these facilities. And if you end up in intensive care, the chances of getting out are not good. You have better chance of surviving if you play Russian roulette with a bullet in the chamber and put it to your head than getting out of intensive care sometimes. So, and people will say, you know, you're exaggerating, talking about the numbers. I hope I am exaggerating. I really hope I am. But let me tell you right now that we are preparing for a situation, literally in days, when the intensive care units are going to be overwhelmed. We're preparing for a situation where we will decide who lives and who dies. It's up to Allah subhanahu wa ta'ala. But the doctors will be deciding who gets intensive care and who is sent to die based on their age, based on if they have any comorbidities. You have hypertension, you have any medical problems, sorry, you don't get an intensive care bed. You have so many, you're over 60, you don't get it. You're over 70, you don't get it. This is the situation that we're looking at. We're staring down the barrel. This is not weeks away, months away. It's not an if. This is days. This could be days away. My brothers and sisters, we're looking at a situation where if we just look at Italy, in Italy, the number of people who are dying are like 4 planes falling out of the sky every single day. Every single day, 4 planes falling out of the sky, everyone dying, and yet We are still queuing up to get on these airplanes. This is the situation, my brothers and sisters. Hundreds of people are dying, hundreds every single night. And Italy went into lockdown 12 days ago. And we have not even done lockdown here. There are reasons for that, but we need to stay at home. Brothers and sisters, this is serious. This is getting scarier and scarier by the second. We're reaching a situation, and Brother Muhammad Umar will talk about this, where they are running out of, there are not enough mortuary facilities or graves. And in Italy, the army is being called in to remove the bodies. This is not the situation that we need to be in. Brothers, the way someone has muted me, I think. I just need to, no, I'm unmuted. Brothers and sisters, this is not a normal time. This is not a normal message. The Haram itself is now closed. Masjid Nabawi is closed. The Prime Minister of the country has come on TV to say that you will lose loved ones. These are not normal times. We cannot behave even half normal in these times. Things have to change. The message from the British Islamic Medical Association and from the medics and the healthcare professionals across the country is very clear, is very focused, is very straightforward.